The man twisted open the bottle, poured the high-proof whiskey over the kid's chest. Then, he put on gloves, disinfected them, cut a plastic tube with a knife, stuck it into the whiskey bottle, then wrapped tape around it. In such way, a simple one-way valve was done. Next, he made a small cut, inserted the plastic tube into the kid's chest. Bubbles started rising in the whiskey. The air trapped in the boy's lungs escaped. Soon, he started breathing again. His parents let out a big sigh of relief. People around them clapped for Sean. Then Sean and the boy got into the ambulance. Sean had a job interview at the hospital that day. On the way, he kept an eye on the heart monitor. Suddenly, he noticed the boy's heart rate had changed, but the paramedic said it was no big deal. He told Sean to stop freaking out. The boy was taken to the hospital. Sean told the female doctor taking over that they had to run an echocardiogram. But after taking a quick look at the chart, she said the boy's heart looked fine. She told Sean to back off. Sean tried to force his way in anyway, but the security guard blocked him and threw him out. Sean muttered to himself as he walked away. In the operating room, the chief surgeon, Nick, noticed the clever one-way valve. He was impressed. The female doctor asked if they should do an echocardiogram. Nick said it didn't seem necessary. Halfway through the surgery, the chief surgeon noticed a small change in the boy's heart rate. He asked the female doctor why she had thought about running an echocardiogram earlier. She mentioned Sean and the one-way valve. Just then, the boy's blood pressure suddenly dropped.
Do an echo.
The female doctor quickly went to find Sean. They asked him why he was so insistent about the echocardiogram. The sudden questioning left Sean flustered. He couldn't explain himself clearly, but the female doctor guided him patiently. Sean finally explained that he had noticed a change in the heart monitor's readings. He believed the boy had pericardial effusion, which was stopping his organs from working properly. Just then, Nick got a call. The ultrasound results came back normal. Nick thought they were wasting time and rushed off, but Sean was convinced something was wrong. The female doctor realized Sean might be onto something. She brought Sean into the operating room. With just one look at the heart monitor, Sean immediately saw the problem.
There. It's not normal. There's a concave deformity in the right atrium.
The chief surgeon didn't believe it could be what Sean thought, but the female doctor thought it was possible. The boy had been hit by glass, cutting his carotid artery. The glass shards could have traveled through the bloodstream to the heart, causing the pericardial effusion. Nick thought the chances were slim, but he ordered the assistant to perform surgery anyway. Sure enough, they found a piece of glass in the boy's heart. Everyone turned to look at Sean. Seeing the boy saved, Sean finally breathed a sigh of relief. Meanwhile, the hospital board was in a heated debate. They didn't want to hire Sean because he's autistic, but the hospital director was determined to keep him on staff.
They do have a shot!